Welcome to Straight Outta Health IT. Getting into health tech is rough, but here's an unfiltered dialogue of healthcare leaders and influencers covering a wide variety of issues affecting healthcare and the health tech industry. And now your host, Christopher Kunney.
Hello, everyone. This is Christopher Kunney, and today we have a very special episode of the podcast. It's actually a joint podcast between myself and my colleague who will be introducing herself in just a second. So I'll just first of all say welcome back to another episode of Straight Outta Health IT. I'm your host, Christopher Kunney, and today we're going to be talking about a little dirty word in healthcare called interoperability and the impact of that in healthcare. And I have the pleasure and the honor of having Dr. Reyes here as well, too. And I'm going to let her take a minute to introduce herself and her podcast.
Hi, Christopher. Thank you so much for taking time out and inviting me to your podcast. I am the host of podcast Leadership in Medicine, and this is a joint episode. I am so excited to talk about interoperability because I know I have someone who is a healthcare strategist and a change maker, and one of the most respected figures in the healthcare industry with us. So that's why I am very excited about this. I am Dr. Riaz, and I am an MD and an MPA from Harvard University. I'm also Edward S. Mason Fellow of Public Policy. I'm an entrepreneur, a consultant, and I have two companies. I started my first company back in 2016, and now I'm running my second company.
Wonderful. And again, I'm Christopher Kunney. For those who don't know me, I am a recovering CIO, entrepreneur, thought leader, and advocate in healthcare. I also run a firm called IOTECH Consulting, and I'm an advisor for a number of different organizations, startups, emerging tech companies, academic institutions, government agencies, healthcare organizations, and I'm very passionate about all things related to how technology can advance healthcare and close the health equity gap. I'm very passionate about that as well. And it's such a pleasure and honor to be on this episode with Dr. Reyes, who is an amazing physician, a healthcare innovator, entrepreneur, and globally recognized leader in transforming healthcare through the use of technology and policy. So it's going to be an exciting conversation we have today. And so one of the things I like to do, Dr. Reyes, is, and I can do the same if you want, is just maybe take a few minutes. You wrote a book about your journey that I want to get a copy of as well, too. So talk to me, how did you end up in the role that you're in today as an entrepreneur, a very successful entrepreneur in the tech field, from coming from a clinical background and now into a technology background and then to an entrepreneurial background in the health tech space?
Thank you. That's a great question. I think my journey started back in 2016. Actually, before that, I was practicing as a physician and I was living in Turkey, in Istanbul, and there were a lot of migrants who were moving there from Syria. And I was working with them actively in healthcare space, and we were encountering a lot of maternal deaths. And the idea of starting something to help those women came from that experience of helping those women. And then one thing led to another. I started from a small startup, and then I built the company, which was basically essentially a data analytics company to prevent maternal mortality and preeclampsia, and also for advocacy of STIs amongst women. And then we started engaging with other nonprofits, with for-profit corporations. So it slowly grew. We did a lot of projects across the world, including in South Africa, where I was nominated for the Nelson Mandela Award.
Congratulations.
Won the Stevie Business Award. So that's how my entrepreneurial journey started. And then I stepped back as the CEO. I sold my company. And then I started my second company, which is Uppshot Lifesciences, in 2019.
Wonderful. Well, first of all, congratulations on successfully launching a company. I don't know all the politics that are happening in Syria at that time, but I would imagine it would have been a challenge as a woman and to start a company and to focus around maternal health and women's health in general. I could imagine that might have been a challenge as well, too. So I commend you on your tenacity and your ability to conquer all the challenges that you might have faced as an entrepreneur in general, but as a female entrepreneur and then probably as an entrepreneur in a community that might have had some additional obstacles associated with that as well, too. And then to not only do that, but be successful and sell the company and then launch a new venture as well, too. So again, I commend you for your journey and your inspiration to us all. Just a little bit about me as well, too, for your listeners. I've been in technology all my career. My background's degrees in computer science and a master's is in management of technology. I've worked for large Fortune 100 companies like Hewlett-Packard, AT&T, some mid-sized companies like Verso Technologies. In the first dot-com bubble, launched my own company back then, where we're doing some of the first e-commerce web development work in the day. And I've also served as a adjunct professor in a number of different institutions, Morehouse School of Medicine, Emory University, Dignity Global Health, and others as well, where I've taught a wide variety of courses related to healthcare and healthcare technology. As I mentioned, I'm a recovering CIO. I've been a CIO for a large healthcare system here in Atlanta, Georgia, where I'm based, but I've also done a number of stints as a interim and fractional CIO for a number of different institutions as well, and then served as an industry advisor for technology companies like Samsung and AT&T and Verse and many others. So I am so excited to continue to be relevant in this space. As I mentioned earlier, I have a real passion for healthcare. One, my mom and father are both deceased, and I think both of them were to some degree marginalized because of the lack of quality care in the communities that they lived in. I grew up in a small rural town. And myself, have been a former patient, I was diagnosed with 2 brain tumors in 2016, and I had brain surgery, recovered from that, obviously. But also, I most recently became a grandfather as well, too. And my first grandchild was born and unfortunately was not breathing at the time. And so due to medical advancements, they were able to resuscitate him. And he is now a beautiful, healthy 5-month-old child. So healthcare is a big part of my life. It's obviously saved my life. It saved my grandchild's life. But I also see the challenges and issues that still exist, both from a health disparity standpoint, technology standpoint, and public policy standpoint. So again, I'm excited to have the conversation about where we are today as it relates to interoperability and how those things are still obstacles, but the promise of interoperability and what it can do as well in our journey. So let's jump right into this.
Right, absolutely. I also wanted to add that you've been the vice president and CIO, as you mentioned, of Piedmont Health, right?
Yes, that's correct.
Yes. And it must have been quite a journey, I'm sure.
Yes, it is. Probably another podcast for another day.
Yes.
About navigating the challenges of a minority in this space back in those days as well, too. So, and I'm sure you had.
Yes, exactly. I think we need a whole new, one more episode just to discuss that.
We'll do that one down the line as well. Right. So let's jump into this conversation. And you said you were really interested in picking my brain about interoperability. I can tell you it's an interesting journey that we've been on, this promise of interoperability. And now that we're moving into kind of this next iteration of it around FHIR and how FHIR has started to maybe improve the standards from HL7 for those of you who may not have a lot of background on how the journey has transpired up to date. You know, the standard in the past was HL7. It was a point-to-point integration type technology, which made it very expensive and very challenging to share data amongst disparate systems. And now we've moved towards a new version of that, which is called FHIR, which is much more based on open standards and creates a greater ability for a wide variety of organizations to share data much more seamlessly and to leverage really the capabilities of cloud technology platforms as well, too. So with things like RESTful and APIs and XML, it allows us to, again, take advantage of some of the advancements within cloud computing that we were limited by some of the more traditional interoperability platforms before.
Right. And, I wrote CPHIMS certification exam recently. So a lot of those things that came up, I was really interested. And I know that you have extensive background and knowledge on this. So what do you think would be the impact that FHIR will have, and you briefly mentioned that, on healthcare interoperability? And how does it improve upon the previous standards like HL7?
Yeah, I think first of all, the ease of implementation, because FHIR is using modern web standards, as I mentioned, like RESTful on APIs and JSON and XML, it's making it simpler and more modular, unlike the much more complex HL7 platform was before. I think it supports more modern-based technology as well, too. Again, as we move to more cloud-based solutions, FHIR makes it a lot more easier for some of the emerging technologies to be able to share data much more seamlessly and much more cost effectively. And there's a smoother transition even from legacy systems, I think, as well, too, using FHIR-based technologies. It allows for patient-centric data sharing as well. It really empowers patients to get them access to real-time data and gives them some amount of control over sharing their own personal records as well. And then there's much more of a global adoption of this technology, this interoperability platform. So some of the leading EHR vendors and health technology companies are embracing FHIR now as a standard, which makes it a lot more easier for emerging companies that are doing things like genomics and patient-centered care and leveraging things like AI and machine learning. It creates a much more seamless way of getting access to that data and sharing that data with a much more diverse community of technology users. And then again, I think it supports some of the flexibility for innovation. It allows you to be able to more easily customize systems and technologies and use those technologies to advance care in a wide variety of areas that in the past it was very difficult for that to happen before.
Right, absolutely. And I know my present company, Uppshot Lifesciences, we have been using AI for genomics and combining that with the genomics profile to come up with solutions for chronic disease management and for oncology portfolios. So I know how important this is moving forward. So in terms of like AI and machine learning, how do you see FHIR evolving in the next 5 years?
That's a really good question. I mean, AI in and of itself is such an interesting enigma right now in healthcare. There's those of us who are very excited about embracing AI as a platform, and there's those of us who are very somewhat skeptical and a little concerned about its impact on healthcare and whether or not it's going to be able to have a high enough efficacy behind it in order to ensure that there's quality patient care and doesn't impact patients' health. But in terms of its ability, first of all, the fact that we can aggregate more data in a much more seamless way through the use of FHIR-based technologies. Now, AI is dependent upon digesting information, right? Aggregating that information, learning from that information so that you can create better and more detailed knowledge and insights from that information. So these kind of standardized formats will allow for kind of real-time or clean data diagnosis, better predictive analytics, because it's, again, able to get access to a wide variety of other sources of data it might not have been able to have in the past, allow for more personalized medicine through the APIs that are now available through FHIR technology, and then just interoperability in general for advanced analytics. I think, again, FHIR gives AI the capability to get access to that information, and so it enables and bridges some of those gaps that we've experienced before. And then we look at things like clinical decision support, for example, and how we can start to, again, aggregate more data from different sources. So now AI can be leveraged as a clinical decision support tool, allows for more accurate, complete, clean information as well, or just a few things that I can see happening and emerging. And I think also it gives and empowers patients themselves, as I mentioned earlier, because now tools will be developed that are going to be more patient-centric and allow patients to get that data and that data to then be aggregated and curated in a way that helps them make better decisions about their own personal care as well, too. Because today, it's a challenge for patients to go through all the medical jargon to really understand what does this really mean for me and how do I now navigate my current condition or my loved one's condition, because all the data I'm getting is all in clinical speak, where AI can take that data and then convert that into more normal human language that individual can take and then again make better decisions about the state of their care and the state of the care of their loved ones as well too. So I see FHIR being that conduit, that method that AI leverages to get access to wider varieties of data that allows it to make smarter, more informed decisions. And that will continue to evolve as AI becomes much more ingrained in how we deliver care. And we look at some of the emerging things that are happening in healthcare right now. We are absolutely going to have to depend on technologies like FHIR and AI because, one, we're not replacing the number of clinicians that are retiring and getting out of the industry today. We have a growing population of folks who are now moving into their senior years, a silver tsunami that's happening right now. Every day, 10,000 people are turning 65 for the next 25 years. And by 2050, 1/4 of the world's population will be over 65. And we're just not going to have enough people to take care of that aging population. So we're going to have to leverage technologies like FHIR, AI, robotics, virtual care, patient-centered medical home technologies so that we can age in place. We can predict issues before they become much more acute and hopefully avoid more major catastrophic issues from happening to that individual so we can get in front of them and be more proactive. And then again, I think it will empower us as a community to start becoming more confident in the use of things like AI, such that I predict this whole vision of the digital doctor, where literally people will be able to go online or on their phone, have a conversation with an AI platform that can provide some basic primary care services for them. It can look at your vitals. It can look at your medical records. It can take the data from your smart devices. And it can then, based on standards that are driven by human beings, still make relatively smart diagnoses and decisions of how to treat that patient. And do that in a very cost-effective way, because I'm not now having to pay the salary of a doctor or a healthcare professional. I'm using technology to do that. So I think it's going to help drive the cost of care down as a result of that, and then allows us to continue to have access to primary care as well, too. Because I even look today, if I try to call my primary care physician today for an appointment, it's going to be weeks out before I can actually see him just because of his caseload. But if I could now go online, chat, because I know every year I get a sinus infection in the fall and in the spring, I know what it is. I can go online, give the symptoms, and AI can say, absolutely, this is a sinus infection. I see your previous medical records. You get them every year. Here's what you have used in the past to resolve that. I think you're right. It's the sinus infection, and we're going to go ahead and prescribe you a Z-Pack and go pick it up at your local pharmacy, or better yet, have it drop shipped to me the same day. So yeah, I think there's a wide variety of possibilities for the use of AI. And then we look into communities that have lack of access, whether it's rural communities here in the US, or you go to some underserved countries that don't have access to primary care. Absolutely. I think these technologies are going to be instrumental in granting them and giving them access to quality care, even in some of the remote areas of the world. I know I said a lot.
Right. No. That's perfect, because I know I've launched a telehealth platform in South Africa. I helped to launch that. And one of the things was that we didn't know how, because it was a rural population and people did not have access to high-speed internet.
Right.
So then we used regular Nokia phones so that at least we got the SMS. But this could potentially change everything, how we perceive medicine, practice medicine, or provide care to our patients.
Exactly. And you can go, I live here in Atlanta, but you can go 50 miles outside of Metro Atlanta, and you won't have high speed access to internet as well, too. And then I've talked to certain regional legislators as well, too. There's certain cities where there's literally, here in Georgia, there's no primary care. There isn't a primary care physician. There's not a clinic. One city in particular, there's only one ambulance in the entire community. So, and the closest healthcare facility is 25 miles away. And so if one person got ill and they took the ambulance and took them to the hospital, and another person got ill or in a car accident the same day, what do? So again, I do think that these technologies are going to continue to evolve. We as human beings are going to get much more comfortable with the efficacy of them. And by the fact that we're not going to have access to human beings on a timely basis, we're going to look at these as alternative ways of getting some level of care.
Absolutely. I know you mentioned that because I remember going to Logansville and also Gainesville here in Georgia, which is relatively close to Atlanta. But you're surprised to see that, you're right, primary care is not available to a lot of people. And, they don't know it's these big parts of our ecosystem where we have no access to care.
And you talk about primary care. Now, what about specialists, rheumatologists and cardiologists and other groups that are even more limited in those communities as well, too? Even if there are large hospitals or a hospital in those communities, in many cases, they still have a deficit in specialists as well, too. And so virtual care technologies are going to allow those facilities to be able to continue to practice medicine and get access to specialists who can consult with the local care providers within those communities as well, too, and still provide quality care, even if they're not physically there as well. And that's going to mean being able to share patient information, whether it's their EHR data or, studies or historical information. It's going to be all necessary and vital for us to be able to continue to provide care in a virtual environment as well. So I would turn the question back to you, though, and ask you,
sure.
in your company and what you're doing in this space, how do you see FHIR being an integral part of what you're doing, and what do you predict in the next 3 to 5 years?
That's a great question. And the way I see it is how we can integrate personal data from personal devices of patients, maybe, make that an integral part of the EMR system so that
Exactly.
the providers have like a more holistic picture of what's happening with the patient, not just when they come and see them occasionally, but like they would have kind of like a more detailed insight into what's going on with the patient. And I think that as we move forward, what I see happening is that eventually these devices will become a lot more complex so that they'll be able to not only just the vitals, they won't just monitor the vitals, they'll also pick up on other symptoms like, for instance, someone has Hep C, the bilirubin levels, cardiac enzymes, for instance. I think that's where I see technology headed, where it would be more personalized and the power would be more in the hands of the patient themselves.
Absolutely. I think, too, it's going to allow, to some degree, companies like yours to be able to compete more effectively with some of the larger players in the marketplace today, because you'll be able to get access to patient information much more seamlessly and much more cost effectively than it might have been in the past. And so those large companies, and we won't mention any names at this point, but there's 3 or 4 who kind of dominate the market today, really control to some degree a lot of innovation that takes place, because either they're prohibiting it to some degree or slowing it down because they see them as competition, or it's very costly to integrate with their platforms because they are the holders of patient information. And I do think technologies like FHIR will create a much more easier, cost-effective, and seamless way of getting access to that data going forward. So innovation outside of the 4 walls of those 3 or 4 large institutions can continue to happen. And companies like yours and mine and others can be major players and influences in the direction of healthcare technology going forward.
Absolutely. Which brings me to the next question, which is related in a sense, that what role do you think APIs and apps play in enhancing the patient-centric interoperability, particularly in healthcare, in telehealth?
No, absolutely. I think first and foremost, it will empower the patient. I think you're going to start seeing, because of the lack of access to care providers as we go forward, patients are going to be looking for other sources and tools to be able to manage their health and make better decisions about their health as well, too. And so I do think that FHIR-based technologies, AI technologies, and others that will allow them to get access to wide sources of data, whether it's research data, population health data, their own records, communities that they could collaborate with as well, too, will help them become much more smarter consumers, patients, advocates for their own care, for the loved ones' care, and will empower them to make better decisions about that going forward. And quite honestly, in some cases, even challenge individuals who are making diagnoses to them, and them going back out and getting second and third opinions and saying, is this the right approach I should take? Are there alternative things I should be considering besides what this care provider suggested to me as a course of action? And so first and foremost, I think it's going to be empowering to them. Hopefully it will start to drive the cost overall out of healthcare as well, too, because unfortunately, these technologies are still very expensive to healthcare organizations. The EHRs and clinical systems theoretically are supposed to drive costs out of healthcare, but today we still see them as very expensive, capital-intensive investments that hospitals have to make right now. And I'm hoping that our ability to share data much more seamlessly will drive some of the help flatten the cost curve there. Getting access to data through repositories versus having to maintain and manage that information locally yourself will help healthcare organizations start to cut some of that internal capital costs out, because they don't have to house that information within their own 4 walls of their hospital. It can be service-oriented platforms. Are just a couple of things that I think that will happen in this space. And again, I think it will empower clinicians to be able to broaden their reach of care beyond, again, the four walls of their hospitals to places like Africa and other communities that might have a limited number of healthcare providers, because now they can continue to not only just provide short-term care, because like you, I've done medical missions as well to places like Ghana, and we've gone and we spent 10, 11 days plus, providing care, and that was a beautiful thing and people appreciated that. But once you got on the plane and went home, you never really interacted with those individuals again because you didn't have access to them. But I think these technologies now will allow us to meet them where they are, because to your point earlier, everyone that we saw, even in some of the most rural communities, still had a cell phone and they still were able to communicate.
Right.
We were able to communicate with them in some form or fashion. So I think these technologies will allow us to continue to meet people where they are with the technologies that they have. And we can, again, provide a broader set of global care in a much more cost-effective way than we've been able to do in the past.
Right. That's fantastic. And I also wanted to say, I know in terms of clinical decision support, I was really surprised that sickle cell is, we know the population statistics, even then it is misdiagnosed to an extent where it just baffles me. And how can it happen?
Yes.
I've come across several cases and stories where it happens regularly.
Absolutely. Well, and to your point, there are certain diseases that affect certain communities that, unfortunately, many healthcare providers weren't trained extensively on, right? And so they're not all that familiar with these issues, especially in certain communities that don't look like them. And I do think that, again, technologies like AI and machine learning that leverage platforms like FHIR gives the ability to get access to that data, aggregate that data, and share better insights to those clinicians who may not have traditionally seen patients that have these symptoms and these issues, and provide much more smarter, much more personal medicine based on a broader set of information that's now made available to them. I know one of the companies I'm advising, for example, right now is a company that's developed a clinical workflow or platform that's focused on pediatric care, because many health systems, urgent care facilities, and others don't have pediatric professionals. And so you've got doctors who were trained on how to treat adults, now trying to make diagnoses and treatments of kids, and in many cases have misdiagnosed them because they're trying to treat them like they would an adult. And maybe the symptoms that a kid is dealing with, a child is dealing with, may be, quite honestly, a little bit different than if those symptoms were presented in an adult. And so that technology, through the use of getting access to a wide variety of clinical information, the patient's information, through FHIR-based technologies, will allow those professionals to be able to ask the right types of questions, get the right types of results, and then hopefully these technologies will help them make smarter decisions around the delivery of care. So just an example, I know of one that I'm working with today.
Right, great. Another concern is obviously the data security. With cybersecurity breaches all the time.
Right.
How can healthcare organizations ensure that interoperability does not compromise patient data? That's a loaded question.
Yeah, it's a loaded question, but it's the reality of it too. And that is, and I do some advising in the space of privacy and security as well too. And so, and I tell my clients all the time, it's not if you get breached, it's actually when you realize you have been.
Yes.
Because most organizations, even the largest ones with the most expensive IT budgets and have all the bells and whistles around security, still have been breached. So I don't know how, in all honesty, how these platforms are not going to still be at risk to some degree. I think the issue is, how do you mitigate it as much as you can? Do you have the right tools in place to do the surveillance needed? Do you have the right types of technology that can help you, once you see some sort of breach that is happening, you can limit its impact to your entire organization? Can you put in things like role-based security and other tools that limit potential end users from making mistakes, or bad actors from figuring out through social engineering how to breach a healthcare organization's infrastructure and get access to their patient information? I think it's going to be even more valuable now that interoperability is achievable and that now we have access to all sources of data. And so we have to make sure that that data in itself isn't compromised before we pull it into our own systems as well too. And that's going to take, again, quite a bit of due diligence on our part with the technology security community, of finding better ways to, again, reduce the likelihood of that happening, but also when it happens, try to mitigate the risk as much as possible. I don't know if that really answered the question because
Yes, yes, that did.
I don't know if there's a magic bullet yet today. If there was, I'm sure people would be using it. But I do think that interoperability will create more challenges around that because now you're dealing with data from broader sets of organizations that you may not have curated or ensured its viability. And we have to just be ever vigilant to make sure that the data that we are getting access to, we're putting it kind of in an extra layer or two of security around ensuring that it does not compromise our internal systems as well.
Right. I just wanted to ask another question regarding this. So what are some of the tools that are being used currently, and how do you think they might evolve over the next couple of years, especially when EMRs will undergo a lot of changes, interoperability will also progress. So what are some of the tools that are being used currently?
Well, I think data encryption, obviously things like blockchain or have a promise for helping to reduce some of the likelihood of security, although healthcare still has a long way to go to fully embrace and apply blockchain technologies into our environment. But I do think it holds the promise of addressing some of those security concerns by creating a higher level of encryption and accountability of the data that's being used. I think putting in secured, APIs so that there's secured authentication for those APIs through technologies like OAuth 2, for example, that can regularly audit APIs and prevent usage from unauthorized users. I think data masking, creating digital twins in many cases may be another strategy for reducing potential access to patient data, and anonymizing that data as well too allows you to still get access to relevant information, but you don't compromise someone's personal data, personal information, which is what's most valuable in many cases. Obviously, we have to continue to train staff and the end user community on being ever vigilant about social engineering that can influence people to compromise personal information or security information. We have to work with trusted advisors and trusted partners who can do this work better than sometimes we can locally. You've got organizations that specialize in protecting patient data. You got security as a service, you've got SOCs, third-party SOC security operation services that can be stood up and support that community and let them do what they do best, which is help to maintain and manage security protocols for your environment while you focus on what you do best, which is treating patients. And then again, I think you have to establish really robust and effective incident response plans. You have to do tabletop testing. You have to test vulnerabilities within your system, and you have to be prepared to deal with catastrophic situations when they happen. And it's sad to say, as much as we fought moving from paper to digital technologies like EHRs, I think if you ask the current healthcare community now, would they go back? Most of them would say no. They wouldn't want to go back. They wouldn't know how to go back in some cases now, because the technologies in and of themselves don't really give you the flexibility to do that. Every clinical, business, and financial healthcare decision now has a technology component built into it. And I use the term that IT is really the next utility. It's like the water and the lights in the building. It's difficult to operate a hospital without electricity, and difficult to operate one without plumbing, and it's difficult to operate one without IT these days, because even the water and the plumbing are controlled by that as well too. So those are some things that
absolutely
come to mind. Yeah.
I just wanted to ask you, this is such a fascinating conversation, and I want to ask you so many questions. So do you see blockchain as a potential solution? I know you touched briefly on it, but do you see it as a potential solution for improving security and transparency in healthcare data sharing? And how can it be applied effectively? I know it has been applied in the past. It has created good results, but do you think moving forward, that would be the right answer?
No, absolutely. I think so. And I think we as an industry have got to start to double down on the use of technologies like blockchain. This encryption and consistent management really allows patients to control access to their data along with clinicians themselves. Blockchain allows and enables standardization across data exchanges, across healthcare systems, and really reduces data silos too, to some degree. Smart contracts around automated data sharing, and blockchain can consolidate health records into from multiple sources of providers to consolidated data repositories that we can all get access to. And so we're all not have to be responsible for controlling the security of the data, can be managed in these larger repositories that have greater control around them. I think blockchain also facilitates kind of secure, as I mentioned, anonymized data sharing, because now you can create things like digital twins, as I mentioned earlier, for research, for things like clinical trials and research, and helps protect the privacy of patients as well, too. And then combating fraud. I mean, one of the biggest issues, along with obviously things like ransomware, is medical coding fraud. And so reducing and combating fraud and improving billing transparency, I think blockchain can have a huge impact on reducing the number of fraudulent claims that are filed, can improve transparency of that information, and can track things like pharmaceutical information, supply chain and verified drug authenticity, and reducing things like counterfeit medications from coming into our environment as well, too. So, I think there's tremendous possibilities for the use of this type of encryption technology. We as an industry have to figure out and be committed to finding ways and embracing it and leveraging it. Now, it's not today, unfortunately, it's not an inexpensive technology to embrace. And so we got to figure out ways to continue to commoditize it such that it's easier for healthcare to adopt it. But it does offer the potential of addressing some of the security issues and privacy issues that exist today in our industry.
Right. I feel like I'm attending this really valuable lecture and I don't want to stop. I'm just enjoying and absorbing all the information.
Oh, you're so kind. I'm enjoying learning more about how you're applying these things. So I would ask the question to you. Are you looking to apply technologies like blockchain into your own business model and the services that you offer as well?
Yes, absolutely. And that's one of the areas that we are exploring. And like I said, for oncology portfolios, building those. And as I said, moving forward, a lot of things will be in the hands of the patient themselves. So as the apps grow more complex, and that's where blockchain is really important because, encryption is important in terms of security.
Yes.
And how we gather the data, how we store that data, because I'm sure there are lots of people who would love to have access to that kind of data repositories.
Exactly.
So blockchain would play a very significant role moving forward.
No, absolutely. You and I could go back and forth for the next hour on this conversation and many more. And
I know.
We definitely have come up to the top of our, already in our episode, unfortunately. So we have to definitely commit to another program of where we can continue to explore this, as well as the other topics you and I have been talking about offline, as well, too, which I think are equally important things to share with our listeners as well, too. So I'm going to ask you, if someone wanted to find out more about what Dr. Riaz is doing and the company that the services that her company is offering, what's the best way for them to reach you?
That's wonderful. So I have my website. It's called ambreenzamariaz.com. You can find my whole portfolio and most of the information about my work over there. I also have upshotglobal.com. That's the website for my current company. And it kind of lays out the comprehensive program of what we do and how we do it.
Wonderful. And I'll do the same. Anyone's interested in learning more about what we do as a company, IOTECH Consulting, you can reach us. We have a website as well, www.iotechconsulting.com. I'm always available on LinkedIn. I literally accept almost every LinkedIn invite I get. So feel free to reach out to me there as well. And as you see, we both have a podcast. And so you can always reach out to us through our podcast platforms as well. We'd love to hear more from you. If you've got topics that you're interested in having us talk about, we'd love to do that as well, too. This has been such a pleasure and honor, Dr. Riaz, to have this conversation with you. So all I want for Christmas is a autographed signed copy of your book.
Sure. It's a book that I co-authored with a few other females, but yes, wonderful. I'd be happy to send you over a copy. I'm in the process of writing my second book as well.
Wonderful.
I will be reaching out for interviews.
Yes, absolutely. And since you mentioned, I'm actually in the process of writing my first as well, too. So I would love for you to contribute to that as well, too. So we have other things outside of this to talk about as well.
Absolutely. And I also want to have another episode where we talk about healthcare equity, because that's a topic that I really want to share,
that's my passion, so.
Exactly. Yes. And that's somewhat my passion as well. So I really want to talk about that and have a conversation around your journey as a in the leadership role. I think that's also very...
I'm happy to share that journey. And as we have shared offline as well, you have a very fascinating and inspiring story as well, too. So I look forward to us scheduling time to do that as well, too. Well, everyone, I think we're done. Unfortunately, we have to wrap this up. Thank you so much again for taking time out your busy schedules to listen in on this episode of Straight Outta Health IT and
Leadership in Medicine.
And Leadership in Medicine as well. Again, we appreciate your support. If you liked what you heard today, please share it with your fellow colleagues, friends, family, even folks you don't really care that much about. I'm sure they can learn from it as well, too. And until next time, take care, and we'll see you on the other side.
Absolutely. And thank you once again, Christopher, for taking time out for this.
Thank you as well. It's been a pleasure.
Thank you so much for listening to Straight Outta Health IT. We hope you enjoyed today's guest. For more unfiltered dialogue of healthcare leaders and influencers, be sure to tune in next week. For the show notes, transcripts, and resources, please visit Apple Podcasts, Spotify, or your favorite streaming platform. We invite you to give us feedback by reaching out to Christopher Kunney on LinkedIn, just searching for Straight Outta Health IT, and you'll find us. We are constantly having live discussions about diverse topics in the industry.